Hello everyone, it's Dr. Cary Yurkiw, and thank you for joining me today for this webinar on prenatal care. We're live on YouTube and on Instagram. And so on YouTube, you'll be able to see my slides. On Instagram, you won't see my slides, but you can just listen to my presentation and what I'm talking about. If you have any questions, please type them in the chat here on both channels. On YouTube, type them in the chat, and on Instagram, please type them in the comments. So today we're talking about prenatal care. And so prenatal care is defined as care before birth. So when a woman is pregnant, as the pregnancy goes on, uh, your body's going to change. And as the baby grows and the weight increases, the alignment and the posture changes. And this is something that we see in the clinic when patients come and they're experiencing symptoms or bodily changes. And we'll talk about that in a second. So prenatal is defined as before birth or during pregnancy. And special consideration needs to be given um, to pregnancy because it's different than other types of conditions that we see in the clinic. So it's really important that we treat it differently. In prenatal care, we look at the posture of the patient. So as the baby grows, the alignment's going to change. The lower back angle is going to change. It's going to become more accentuated. So you're going to see a little bit more of a curvature. The ligaments are going to become more lax. So you're going to see more flexibility in the joints, which is good and bad because the joints can go out of place easier, as well as they can be put back into place. The alignment can change quicker. So as time goes on and the hormones are getting released, oxytocin, and the ligaments are changing, it can change the spinal curvatures. You can get an increased lumbar lordosis, an increased thoracic kyphosis, and the neck can change too because everything is linked together. So this is what we look for when someone comes in that's pregnant and someone who may be experiencing some symptoms. So what are some of these symptoms? Well, the conditions that we see are sciatica. And sciatica is a result of the baby growing, the pelvic changing, and then pressure on the nerves in the lower part of the spine. And that's in the lumbar region and the sacrum. And the sciatic nerve is composed of 5 nerve roots: the fourth lumbar, the fifth lumbar, and the top 3 sacral nerve roots, S1, 2, and 3. So what happens is these nerve roots come together to form the sciatic. And if the alignment changes here, it can put pressure on the nerves, and then the nerve flow is affected going down the legs. And that could be just one leg or sometimes both. So this is a condition called sciatica because it affects the sciatic nerve. It can cause low back pain because pinched nerves in the low back are painful. And when the alignment shifts, maybe a vertebrae shifts right to left, or it rotates, or front to back, it can cause pain in that local area. Another thing that we see is the rib pain because for pregnant women, when their lower back is changing because of the baby and the weight of the baby, then they're compensating with the upper back. And as their back rounds more, the rib alignment changes. So we see the ribs protruding more to the back, and then that affects the attachment of the ribs on the front part, on the sternum. So we see changes to the alignment of the spine, as well as the ribs that are attached. And so there's 12 segments in the middle part of the spine called the thoracic spine, and 12 ribs attached on the right and the left. And this can cause rib pain, and rib pain is painful. Sometimes it'll pinch the nerve coming right out of the spine here in the thoracic area. And sometimes it'll the rib can shift, and then you get pain localized in that rib, or maybe referring around the ribs because there's the intercostal nerve comes out of the spine and then travels between the ribs through the muscle area. And then neck pain. Neck pain can be a result of these postural changes, and now the you're struggling to keep your head up, but yet the posture is forward, let's say, and so now that accentuates or increases the tilt of the head on the neck or the neck on the shoulders, and that can really cause neck pain. And neck pain can then refer down into the shoulder region, into the chest area, down the arms. Neck pain can also lead to things like headaches. So we do see patients coming into the clinic with these conditions as well. The other benefits of chiropractic care during pregnancy, better alignment. So with better alignment, you're going to have better energy and better ability to do things. You'll be able to walk farther, stand and do activities better. So it's just going to make you feel better with chiropractic care and chiropractic adjustments. Adjustments are safe. We screen the patients. We do a thorough history examination. So we're going to make sure that they're safe for you. But chiropractic adjustments during pregnancy are safe. It's going to help with delivery because when you go to deliver the baby, if your pelvis is more symmetrical and you have a better symmetry of the muscles and the tone of the area, it's going to help with the delivery process versus if the pelvis is twisted and now the baby's trying to come out, but there's a rotation or a tilt to the pelvis. And then, of course, after you deliver the baby, getting back to the way you were before, you'll be able to recover faster with a body that's in good condition. So those are the benefits of chiropractic care during pregnancy. If you're in the Kelowna, Okanagan area in British Columbia, we are taking new patients. Pretty easy to book an appointment with us. You just scan this QR code with your phone and it'll open a link. And the link is called Linktree right here. So you can also click on the link in the show notes. I'm just going to quickly show you what happens when you click on that. So I'll show you the menu here. And you're going to get a menu like this that'll pop up for you. If you're on Instagram and you actually click on the link in our bio, you're going to go here to this menu. And then on the menu, the first link says book first appointment. So that's for new patients. And when you click on that, what'll happen is it'll open up another screen with a calendar. You can pick the day and time you want to come in. And then once you do that, we're going to send you the paperwork in advance to fill out online, and then we'll be ready for you when you get to the clinic. The other links you're going to see are webinars. So webinars like this, and some of them are free and some are paid. You're going to see the upcoming webinars on Eventbrite and on Facebook events. So please join our Facebook page. You can just click on the like button and I'll give you the address in a sec. I've written 2 books on Amazon, one on back pain and one on neck pain. You can click on these links and it'll take you right over to Amazon. And those books are in 3 formats, ebook, paperback, and audiobook. If you want to see some testimonials of our patients, click on this link and you'll see some testimonials that our patients have given us over the years. YouTube, we save all these videos on YouTube, and subscribe to our channel and like this video. And if you want to see the previous videos, just click on the YouTube button right here. You can go back and watch some of the videos and webinars we've done in the past. And then the last thing on our menu is the podcast. And our podcast is called Super Healthy. It's on Apple and Android. And if you click on this, it'll take you right over to our podcast provider, and you'll be able to see all the episodes as well as this one. And then you can also follow us on Apple and Android. You can subscribe to our podcast. If you're on Spotify or other channels, you can see that it's called Super Healthy on that podcast channel. And if you subscribe, you're going to get the notification when we do a new webinar or new audio. So these are ways you can follow us. I want to thank you very much for joining us today. One more thing I want to give you is the handles of how you can follow us. So just going to go back over here, and on social media, We're at Dr. Cary Yurkiw. So that's DrCaryYurkiw, two Y's together. And that's on Instagram, on Facebook, and on Twitter. So please follow us on those channels. Subscribe to this channel on YouTube. So it's Dr. Cary Yurkiw, same handle. Subscribe to this channel on YouTube. You'll get notified when we're live. Actually, a patient of mine last week said, I joined you live because I got notified by YouTube. I was just scrolling on YouTube and all of a sudden I got a notification saying you were live. So that's great that she could join us. And again, the podcast, it's called Super Healthy on Apple and Android. So thank you very much for joining me today. I appreciate you being here and your time. I hope you learned something about pregnancy and chiropractic. And certainly, if you have any questions, you can reach out to us here on Instagram by messaging me, or you can leave a comment in the show notes here on YouTube. Okay, have a wonderful day, you guys, and I'll talk to you soon.